Yeah, Mary Tabbitt, and I'm very honored to have Prapa
Hi, pleased to meet you.
Gosha?
Ghosh.
Ghosh. Nice to meet you,
Nice to meet you as well.
So we spoke a little bit before, and if you can just let the viewers know what your specialty is.
So thank you very much for having me on this show, Mary. So my name is Dr. Prapa Ghosh. I'm a specialist in urology. Little known fact that urologists are actually surgeons, so we don't just do rectal exams all day, which is what most people to go to a urologist for. So, you know, we can just stop the whole furrowing of the eyebrows. Like, why are you women going into urology thing? Urology is an amazing field. It's one of the most innovative fields out there. We do everything from robotic surgery. We're the only field out there that can actually remove cancer from somebody's bladder and replace their bladder with a new bladder that we made out of their intestines.
Wow.
We're the first ones to do laser surgery, the first ones to do surgery through people's skin. You know, we're like the cowboys of surgery. And when I came to know that, I've joined the ranks of the urologists and the urological surgeons, and I've never looked back. It's a phenomenal field for men and women to be in.
Right, and you know, some people have thought that it was just for men, but no, it's for men and women.
Well, of course, because
You've
we
got
deal
kidneys.
with,
Everybody has kidneys.
Absolutely, we have stones. Everybody's got stones. Yeah. Unfortunately, everybody's got cancer in the kidneys, the ureters, the bladders. Everybody's got incontinence issues. In fact, women far outnumber men, so I see that a lot. And there's just a whole host of things that we couldn't even imagine could go wrong with our genitourinary tract that you know, we can specialize in and really help take care of.
Okay, so again, you were talking to me about you know, doing a surgery to help somebody with bladder control.
You know, bladder control is it's such a difficult topic for people to bring up, and I oftentimes see patients who've been suffering for just years and years and years, and it's so sad. Either they decided that they didn't need help because it was just an old lady problem or an old man problem, or you know, they did seek the help from various specialists and they unfortunately didn't get the help that they need. There's so much misdiagnosis out there that I've found. A lot of people get misdiagnosed with recurrent UTIs, for example, when they never actually really had one, and they're having a type of urge urinary incontinence, which we can fix and get to the bottom of. So, you know, I want you all to know out there that incontinence is not something that you have to live with. And, you know, urgency, for example, happens for different reasons for men and women. Both very, very fixable problems. Incontinence oftentimes is. And, you know, really we go from the whole host of medication all the way up to these really nifty new procedures that we can offer to get you to the point where you can be fully continent and happy with your life again. You know, I think I told you this before, I'm a cancer surgeon. So I went into my field thinking, you know, I'm going to be one of those hardcore people fixing people from these, you know, deadly ailments that kill them, and do it using these powerful robots. And I love that part of it, don't get me wrong. If you have a kidney cancer, I'm here for you. But what I came to realize after years of practice is that, you know, if you have a kidney cancer and I take it out, you know, you never felt the kidney cancer. You know, you came to me, I took it out, you went home the next day, we follow up, but it didn't really change your life. But when somebody's going to the bathroom every 15 minutes, or he's leaking, you know, when they're in a public space, it changes their life every day. You know, they can't go to concerts, they can't sit at dinner, they can't go out with their friends. They're always constantly worried about, am I going to leak urine, or in some cases even stool? And it's confining.
It is.
And when you can help a patient fix that daily, hourly, sometimes even minutely problem, it's so fulfilling. You know, it's so nice to be able to actually change their life that way. They can lead a better life once you fix them. So I've learned a lot.
Yeah, I remember going on vacation with my father, and he was having prostate problem. And we went to Las Vegas, and I had to find where the bathroom was so that he could play in a certain area. God forbid he had to run to the bathroom. So that's kind of what people have to go through, their struggles that they have to deal with.
Absolutely.
So,
you know, and I've had cases where women literally told me after they got surgically treated that, Dr. Ghosh, I sat through my first dinner with my family.
Oh, wow.
I went to my first concert, young 35-year-old women,
Wow.
and some cases, older people who came up to me and said, I could never go to see that favorite theater I've always wanted to see before, and now I can.
Wow.
It's, I always wanted to go to Europe, but I was always too afraid of not being able to find a bathroom in time, or even forget about Europe, just New York.
Right.
We all know how hard it is to find a bathroom in New York,
Right.
And most of us don't think about it. We can hold it, right? But for somebody who's struggling with that, it's just so difficult.
Okay. So people can come and visit with you and do a little, you'll do a consultation with them and help them with that? I mean, is that something that they would have to book?
Absolutely.
Yeah.
But, I want people to know that, you shouldn't be embarrassed about it. It's
Right.
such a common problem. 1 out of every 3 individuals have problems with urination, urinary incontinence, and really nowadays the sky is the limit in terms of what we can do for you. So like I said, there's different physiologies in men and women, and there's also different types of incontinence. First, we have to find out and assess you. Are you having stress incontinence where you are coughing and sneezing and leaking? Are you having urgent incontinence where you gotta go and you can't make it to the bathroom in time? Are you having overflow incontinence where something's physically causing a blockage to the urethra for whatever reason? This can happen in women from a tightening, or in men from a prostate growing too big, okay?
Right.
Which is very, very common. Or you're having a mixture of all 3 of those things or 2 of those things. And we
Right.
have some really fancy ways of finding out, okay? And then once you do that, we have so many minimally invasive options, everything from, medicine, of course, and if you fail that, then we can go all the way up in some cases to implanting, believe it or not, a pacemaker for the bladder. And that works actually for both incontinence of stool and for incontinence of urine, and has almost a 90% efficacy. I mean, it's amazing the technology that's
Wow.
out there. I've had so many patients that, thought that they hit the end of the road, and we could do things like that for them. And it's just incredible to see their lives change.
Wow. Well, I definitely learned something today, and I'm sure the viewers have too. So I hope we can have you come back on and
Sure.
give us a little bit more information. Is there some place that people could find you?
I work for Garden State Urology, and
Okay.
we're located in Wayne, New Jersey. I'm in practice with Dr. Abraham Knoll, and come visit us in our Wayne office if you'd like. My staff is absolutely lovely.
Okay.
And it's the best part about my job. I love my partner, I love my staff, and I love taking care of patients. So, we try to always do the right thing. And I know it's kind of hard to find doctors who do that, and I've always really, tried to look at it from the patient perspective. I myself have been a patient in the past, and I kind of know what I would want my doctor to do. So we try to be those people for our patients.
Well, you definitely speak our language. You don't speak over our heads. I feel very comfortable with you, and I'm sure
you.
everybody else will. And thank you so much for coming on and
Thanks,
sharing.
Mary.
Thank you.
Appreciate it. Take care.